Okay, so some options with your curettes. You can order hand-activated curettes with the shank flexible, rigid, or extra rigid. So basically, if it's flexible shank, it's going to have better tactile sensitivity, but sometimes it really doesn't lay into the calculus and remove any significant calculus very well. So we tend to get all our instruments in rigid. And in private practice, if you don't specify, especially on the East Coast, they tend to give you flexible. So make sure you specify what type of shank flexibility you would like. There's also all your area-specific curettes can come in an after 5. And basically what that means is there's 3 extra millimeters in the terminal shank. So the thought is you can better treat after 5 millimeters probe depths. The blade is also thinned by about 10%, and it provides increase in crown clearance and will help you achieve parallelism on deeper pockets on your perio patients. Now, some after 5s are then, you can also get a mini version, and a mini is really talking about the blade. And you have one in your kits. Like I said, it's either your 1-2 or your 5-6, and it means the blade is 50% smaller. So try and find that in your kit. See if you can figure out which one it is. So the blade is smaller and it's a little thinner. There's another type of instrument too that you can get all the curettes in micros as well, and they're even a little smaller. So these are basically all variations in shank and with flexibility, with extensions of the shank, in blade size. The variation in how the shank bends doesn't change. For example, like a 15-16 mini and after 5, the design of it will all be the same. The only thing is there'll be 3 extra millimeters in the terminal shank, but it's the same shape. So here's just showing you a standard curette, an after 5, and a mini 5. And what I've done here is put an orange line through the beginning of the terminal shank on a standard, drew that line straight forward, and then you can compare the terminal shank where it begins on an after 5. And these are the 3 extra millimeters they're talking about. And here's a mini 5. You can see the blade is 50% smaller than the regular after 5 and the traditional standard Gracie. This is also showing you the extended shank, so the difference in after 5s. So why do we get after 5s? They're really great for perio patients. When you're first learning, they might be a little, too much to handle, but you will want to use them the more comfortable you get with instruments, your second semester, and certainly your last year, you feel more comfortable and be able to use the after 5s very well. So here's just showing, sometimes they can come in handy, especially on interiors when you're deep onto the root. They can adapt to the root surface, the root morphology. They're really nice in longitudinal depressions and concavities, and it can be more comfortable for the tissue. It's less to negotiate. So those are some positives of the minis. So great for interiors, great for narrow roots, depressions, direct proximal surfaces, furcations. They're amazing. Minis are amazing for furcations. but we'll get into that more later. Speaking of after fives, here's Anna Patterson. She's created textbooks. I had her textbook when I was in school, and this was last June. Professor Lombardo and I went to ADHA, and this is Ann O'Connor as well, who works for Hugh Freedy, and Ann is also a thought leader as well for Hugh Freedy. And we were at that conference doing lifelong learning. So I know it seems like when you're in school, there's always so much to learn, but it really never changes. We're always going to conferences and always working on our professional development. So that was actually a fun time that I thought I'd show you. This is a video comparing the difference in a full-size blade compared to a mini. So that first stroke was a full-size curette, and here's a mini. So there's really no difference in the amount of deposit. So sometimes people think, oh, you're using a mini, it's going to take forever. There's no difference. It's just, you feel like you're accomplishing less because the whole blade is smaller, but it's not true. So handles, you can order your instruments in any kind of diameter, whether you like resins. All your instruments are the widest diameter, as well as their EverEdge 2.0. And what that means is the EverEdge technology means your instruments will stay sharper than traditional instruments, so you don't have to sharpen them as often. So you have really nice instruments, and you want to be mindful if you don't have that edge retention feature of your instruments, you'll be sharpening. So if you go into an office that doesn't have them, don't be surprised if you're sharpening twice as often and more frequently. So it's something you always want to be checking for instrument sharpness. They don't stay sharp long, unfortunately. The other thing that will be more important is to make sure that your instruments are always balanced. And one way you can be assured that that happens is always by buying your instruments from a reputable manufacturer and not retipping. Retipping instruments is cheaper, and it's recycling instruments, but they don't have to make the instruments balanced. And once an instrument is retipped, they'll have to mark it on the instrument, and then if anything happens, the original manufacturer cannot really support that instrument anymore. So what does balance mean? That means if you drew an imaginary line through the handle and divided the working end, you should divide it in half, okay? As opposed to drawing the line straight through. And look at this. This is a sickle instrument, but it still should be balanced and be in the center of the working end on the middle third, but it's in the heel third. So you will be more apt to break instruments like this. This happened to me in a perio office. I had never broken an instrument ever, and then I kept breaking instruments, and then I looked closer at and they were all retipped, and that was their philosophy at that practice prior to me joining them. So we kind of talked about that problem. Okay, so let's take a look at some instrumentation. Now, this is a common thing that we see when you're working on your Typodont, and your Typodont can take the abuse and can take the pain, and they just sit there and they're lovely, and we thank them. But you want to think about your Typodont being a real patient that would experience pain, and you want to practice using your Explorer and everything correctly. Your mirror correctly. For example, look at this grasp or lack of the mirror, and look how they have the cheek way out and fish hooking the lip. So you want to practice really good indirect vision and using your mirror correctly whenever you can. And when we're first learning things, it's a little too much. But the second we go into clinic and you have a pole and you can practice positioning with your Type-It-On in the chair, you want to make sure and use those cheeks and don't cheat and flip them over. Okay, so here you can see the Explorer, again, the grasp. And then can you also see, look at how the instrument just hit, if that were a patient's lip, it were to hit the lip. So you want to think about making really nice movements on your Type-It-On and trying to avoid things just like you would if you were working in the mouth. This will help with transition. I'm wondering if you're noticing any other mistakes. So some improvements here could be made on the finger flexing. There was a lot of finger flexing going on, see right here with the pinch as opposed to a wrist rock, and see how that pad of the finger is coming up, and a lot of movement with the grasp. We really want to think about the grasp being stable and not moving. And what is happening, they're trying to roll the instrument but keep moving their fingers. If you find you have rolled the instrument and you have a difficult grasp on the instrument, just come out safely away from the mouth, readjust, and go back in. And that would be a safer way to do it. So here is a little finger flexing, and it might be hard to see, but what tooth are they fulcruming on? They're fulcruming on the same tooth they're working on, right? And that's really an unsafe procedure. So you really want to make sure in this area you're more in front of the area, you're on the premolars, and that you're not going to hurt yourself with your instrument. So always make sure you're at least a tooth away. Oh, this is the Waimea Canyon. This is one of the most beautiful hikes that I did last year. And they were all these helicopters kind of going in this ravine area, but it was just gorgeous. So I thought I'd show you a picture. Okay, so some key points to scaling that I want you to be mindful of. You always want to make sure and reach the base of the pocket. You always want to use overlapping strokes. You need to be really careful on the line angles because that's where we typically leave calculus. You always want to complete one tooth at a time. Sometimes we don't realize how difficult the scaling is, and we'd rather have you do one quadrant or one tooth versus doing all of the teeth a little bit. There used to be a tradition, maybe in hygiene, it was called gross scaling, where you would just remove the big pieces of the whole mouth. And what they found was that really wasn't productive or in the best interest for the patient. So we tend to be very systematic and only start what we know we can finish. And you want to make sure that you're using various lateral pressure. You're always evaluating your work as you go. You'll use your Explorer to detect calculus to evaluate your work, and then you'll want to evaluate the host response and see how the tissues have healed. If they're still bleeding and pocketing, perhaps you have not removed all the residual calculus. So check those areas carefully. So when do we check the host response or how the patient has responded to treatment? Typically about 6 to 8 weeks after our scaling visit. And we traditionally don't probe right away. We wait after scaling. We like to wait for that healing, that 6 to 8 weeks. And you use your Explorer to check your work as you're going. So are there any contraindications for scaling? Absolutely. So one of the things you want to think about are dental implants. For those, we use specialized instruments. You can use non-metal instruments. You can use plastic instruments on the crowns only. You want to avoid using plastic instruments on the threads of implants. They've actually found that harbors some of the plastic into the threads. So we have some titanium area specific curettes, and there are power driven options as well for implants. Oops, I have a word spelled, implants spelled wrong. My apologies. So scaling is invasive. So if your patient requires pre-medication, then they absolutely need it for scaling. So watch out for those heart valve, aortic heart valve replacements, patient previous history of bacterial endocarditis, and the list continues. So you always make sure you've done a thorough health history, and your assessments are always done prior to scaling. Safety issues. You want to remember your ergonomics. I know sometimes we want to just dive right in and be right on top of what we're looking at. But you want to remember long term, your neck or your back really won't appreciate that. So try and have great ergonomics, be as neutral as possible, relax in between all your strokes, go nice and slow, controlled, pause, relax, and try and stretch during long periods of working. You want to make sure lateral pressure only on the coronal stroke and never on the apical stroke. Check your body mechanics. We know bad repetitive movements over time increase our risk for mucoskeletal injury. You also remember, don't fulcrum on the same tooth that you're working on. Don't use your patient's chest as a collection of instruments. You also don't want to wipe the blade with the patient's bib, or taking it, like in this picture, taking your sharp instrument to your hand or skin. So we tend to wet a piece of gauze, weave it through the cassette, and debride our instruments on that as opposed to in our fingers. You want to make sure your instruments are sterilized, you have the proper indicator strips, you've confirmed their sterility, you have broken the seal in front of the patient. You want to avoid flipping your instrument over your patient's face. So it's fine if you've determined you don't have the wrong end, but go away from your patient's face and flip it away from them. You also want to be mindful you're not taking instruments in your hand and moving the light. You also want to have a nice, neat tray. You don't want instruments all over the place where someone can hit an instrument and have an exposure, an unnecessary exposure. So you don't want the flat floss and bloody gauze all over the place. You want to keep your bloody gauze. You can keep it in a paper cup near your area and put it there as you go so it doesn't look like a crime scene. And here's my last picture. This was another beautiful hike in Hawaii. This was through amazing trees that we would go under. We went through caves. We ended up on the side of a golf course. It was just amazing. If you haven't been to Kauai, I hope you all get a chance. All right, thank you for listening. Good luck with your curettes. Scale in peace, my friends.